Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Oral semaglutide demonstrates a 14% reduction in risk of major adverse cardiovascular events in adults with type 2 diabetes in the SOUL trial. The SOUL cardiovascular outcomes trial was a double-blinded, randomized trial that compared oral semaglutide to placebo as an adjunct to standard of care for the prevention of major adverse cardiovascular events. The trial enrolled 9650 people with type 2 diabetes and established cardiovascular disease and/or chronic kidney disease. As a part of standard of care, 49% of patients received SGLT2I at some point during the trial. The trial achieved its primary objective by demonstrating a statistically significant and superior reduction in major adverse cardiovascular events of 14% of people treated with oral semaglutide compared to placebo. The primary endpoint of the study was defined as the composite outcome of the first occurrence of major adverse cardiovascular events defined as cardiovascular death, non-fatal myocardial infarction or non-fatal stroke. All three components of the primary endpoint contributed to the superior major adverse cardiovascular events reduction demonstrated by oral semaglutide. In the trial, oral semaglutide appeared to have a safe and well-tolerated profile in line with previous oral semaglutide trials. SOUL was a multi-center international randomized double-blind parallel group placebo-controlled phase 3 cardiovascular outcome trial with 9650 people enrolled. It was conducted to assess the effect of oral semaglutide versus placebo on cardiovascular outcomes in people with type 2 diabetes and established cardiovascular disease and/or chronic kidney disease. The SOUL trial was initiated in 2019. The key objective of SOUL was to demonstrate the oral semaglutide lowers the risk of major adverse cardiovascular events. The key objective of SOUL was to demonstrate that oral semaglutide lowers the risk of major adverse cardiovascular events like a composite endpoint consisting of cardiovascular death, non-fatal myocardial infarction and non-fatal stroke compared to placebo. Both added to standard of care in patients with type 2 diabetes and established cardiovascular disease and/or chronic kidney disease. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.